To that end, we are announcing today, as you've heard, that we've taken steps to get more rapid testing clinics or kits into more places across this province. To support the expansion of point-of-care testing, the government has amended the medical lab licensing regulations to exempt potential additional sites from requiring a lab license to deliver these safe and simple tests. This means we can take steps to get more than 700,000 rapid test kits available from the federal allocation to have a wide variety of additional sites in the province, which would be in addition to the long-term care homes, which already have access across the province to point-of-care testing, and our acute care sites. These are simple tests, are readily available, and some of the new sites that will be included in this expansion include personal care homes, group homes, detox facilities, emergency shelters, and schools. Rapid tests will also be made available to ambulance, police, and fire services, as well as pharmacy and dental offices for staff that work within those areas to ensure that we're screening essential workers in those areas. We are currently looking at many ways to improve the booking and communication process, not just for phase 1, but also phase 2 in the province, and you'll see some important changes in the upcoming very soon, including, as you know, today we're primarily using a way of us contacting residents, but we'll be moving to a system where residents are able to contact us and choose their vaccination site and their vaccination time, which will greatly improve the process, but it will still be hampered by a lack of vaccine supply until vaccines start flowing in a consistent manner.
With variants of concern coming, and the fact that up to 40% of infections can be asymptomatic, even with variants of concern, testing will continue to be an important one layer. The more easily accessible it is can only be a good thing, but it's just one layer of all the other things we need to continue to practice.
Can you provide any insight on what's going on in the Regina area? Is there any evidence that one of these variants of concern could be driving what seems to be a rise in cases?
Yeah, so I actually have daily discussions with all medical health officers, but especially this morning, again, with the colleagues in Regina, both in the RRPL lab and public health, medical health officers. So I think right now, obviously, we have found variants of concern in 2 instances that were community acquired, not acquired through travel, so that's of concern. Whenever there's an outbreak, and that's been in place for several weeks now, whenever there's an outbreak, samples from that outbreak are always sent for whole genome sequencing, so that's happening right away with any outbreaks in Regina. And the rates that have been reported on the higher side, 80 today, and also some of that was adjustment from a lower number yesterday, but some of them have actually been generated by investigation of active outbreaks, especially in daycares. So as you know, whenever there's an outbreak, everyone who may have been exposed is tested, so that does increase the testing volumes, which is a good thing because then cases can isolate and the close contacts can go into quarantine, and that breaks the chain of transmission, so you don't see second or third generation. So that's driving some of the high case numbers, but absolutely any outbreak in Saskatchewan, not just in Regina, will have samples from those outbreaks sent for further analysis to see if they do variants of concern.